Hi, I'm Dr. Kylie Stewart, and I thought I would take some time to kind of share a parent's experience with you as you've really looked into other health impairments, students with deafness. I wanted to take some time to really share our experience raising a child who really falls under those two categories of other health impairment and deafness, and just thought it might give you kind of another perspective on, although you see these students during the school day, kind of what home life can look like, how parents can approach education, and just that team approach of what it can do for these students. Because we typically know that these students are really in a smaller percentage of the students with special needs that we work with in our resource rooms, in our schools, and so at times we don't always have the expertise in these areas that we may in other common disability categories like learning disability or students with autism. So I wanted to just take some time to share our story. Just to give you a little background on how it all began, we have 3 children. Our oldest, Josie, who is now 8, was diagnosed at 18 weeks in utero with the Dandy-Walker malformation, which was a cyst in the ventricles of her brain, and it caused the 2 hemispheres of the cerebellum to not join properly during development. So Josie was born early at 36 weeks due to failure to thrive and slow growth, and so she was pretty small, 4 pounds 3 ounces. And so we knew that we had some developmental issues that were going to occur there because of her brain development. What we didn't realize were there were a lot of other little tweaks to her body that occurred in utero. One of those was that her ears didn't develop correctly. And so she had an enlarged vestibular aqueduct in her right ear, which caused significant hearing loss, severe hearing loss in the right ear, and then she had moderate hearing loss in her left, so she failed her hearing screening before we left the hospital. And then we really spent the next couple of years dealing with a lot of illness, multiple surgeries. She's had 12 surgeries to fix things within her airway. She had some clefts within her airway that were fixed so that she couldn't develop pneumonia because she aspirated into her lungs if she drank or even aspirated saliva. And so we also had a feeding tube inserted because she is unable to eat on her own because of some of that structural abnormalities, but also just because of some oral motor dysfunction that also has prevented her from learning how to speak. And so those first couple years were just a real challenge, keeping her alive, for lack of a better word, and keeping her healthy. But we were able to do it and really repair a lot of the things that needed to be repaired there. So during that time, Josie received infant-toddler services in our community. I know a lot of you may be familiar with that, especially if you work in elementary school, because you have kids come into preschool from infant-toddler services. And we had a whole range of supports through that system: feeding therapy, occupational therapy, nutrition support. We had nurse support that came out and really helped us through some of those medical challenges, speech therapy, and then we also had deaf family support. We had a person from Kansas School for the Deaf that came out and really helped us integrate sign language into our home and really helped us as a family learn how to sign with Josie, because we were really learning the language along with her. And then another one that we had was physical therapy, because Josie has a lot of low muscle tone issues, and so she crawled late, she walked late. The reason I put this picture on here is this is her brother, Henry. He was born when Josie was about 18 months old, and he really, I have to say, it was like he was a therapist for her, because as he started to do things, it really pushed her to learn how to do things. So they learned how to crawl at the same time, they learned how to walk at the same time. So that kind of gives you an idea of how delayed she was in those gross motor skills. But he was a great role model for her in terms of really pushing her to learn how to do those skills. Here you can see he's kind of teaching her how to go up the stairs and patiently waiting for her to catch up to him. So infant-toddler services was really an integral piece to Josie's early development. And the nice thing about infant-toddler services is they come into your home. They really look at the family unit as a whole, your home as a whole, and how they can support the child in that setting. And at that age, that was really what we needed for Josie. And then when Josie turned 3, we started looking at preschool options. And so we live in Olathe, So we have really close access to the Kansas School for the Deaf, and they have an immersive language preschool program. So it's a full-day program that students are in from the age of 3 till kindergarten, and it really immerses them in ASL. This was important for Josie because we're a hearing family. ASL is not our first and natural language, and so it was very important for her to be around deaf role models and to have access to people who were communicating in ASL all day. And we really saw her language thrive in this environment, and her ASL development really went up quickly. The other nice thing about the preschool program is they have hearing peer models, which are typically hearing siblings of other students who are deaf or hard of hearing. And so Hank was able to go to KSD for preschool for 1 year and really immersed him in that ASL environment, so that Josie and Hank really communicate well now together because he had that opportunity to learn ASL, which was very important for him too, being a family member of Josie's, to really learn how to communicate well with her. So the preschool experience was a really heavy focus on language for Josie, really developing that ASL language and being in that environment, having those deaf role models. So once we went to elementary school, we continued at Kansas School for the Deaf, where Josie did kindergarten and first grade full day. And so I will say that Josie's day was sometimes modified a little bit because of her health issues and that low muscle tone. She gets tired easily, she fatigues. And so at times we would have a modified schedule, so she maybe wouldn't attend all day, or she would have pieces of her day, for example, maybe have one less recess and do some pull-out for speech or OT or PT during that time, just to give her body that rest and that break that she needed in her day. As we started looking at what to do for second grade, which is where Josie is this year, we really wanted to look at how do we help her develop and be a successful participant in both the deaf and the hearing world. You know, our family is hearing. A lot of what we do outside of the home, whether it's at church or in our neighborhood, is in a hearing environment. And socially, Josie didn't, she kind of struggled with social skills. She struggled to initiate conversation with others, even those who signed and were comfortable communicating with her in sign language, and kind of struggled to make some connections within our neighborhood, which we felt was really important for her. So we started looking into a dual placement model for Josie. And so currently she goes to school at the Kansas School for the Deaf in the morning, which allows her to do ASL instruction there, reading instruction, literacy, writing, which is really important for her ASL development. And then in the afternoon she goes to our neighborhood building in the Blue Valley School District, where she works on math and writing with a deaf educator. The reason that's important for Josie is ASL has a very different grammatical structure than English, so she's really considered English as a second language child. So when it comes to written language, her natural tendency is to write in ASL, so writing in that grammatical structure. And so the deaf educator is really working with Josie on writing in English and following the grammatical structures of English. So it's a great opportunity for her to just get some additional assistance in that area. So it kind of gives you an example of what Josie's day looks like currently. She has an interpreter that works with her in the classroom, and she is bused over in the middle of the day after lunch to attend Blue Valley in the afternoon. And none of this happens without a team effort. I mean, you talk about a team, this kiddo requires a big team and has always required a big team to be involved in her daily instruction, in her IEP development, all the supports that are required there. This is a picture of her kindergarten teacher, Paul, who she absolutely loved, and her para, LaDonna, who has been with us for getting close to 3 years now, who is her medical parent and is with her every day and just has been an amazing support for Josie. And so Josie, of course, has that one-on-one para support every day. She has 2 grade level teachers that we work with now because of the dual placement, resource room teacher at Blue Valley. Several nurses are involved in her day-to-day needs because she is tube fed, and so she does 3 tube feedings a day at school, which the nurses sometimes assist with, but LaDonna, her para, has also learned how to do those tube feedings. And then the classroom teacher goes through training every year at KSD to be able to do those tube feedings as well, kind of as a backup. She has a deaf teacher that works with her at Blue Valley that comes in a couple times during her afternoon and works with her, sometimes doing language preparation to get ready for math, so going over the signs of the language they're going to be using during the math instruction, and then also helping with that written language kind of ESOL goals that we work on. Assistive technology is involved because since Josie is nonverbal and she does have some fine motor issues with writing because of that low muscle tone, they're looking at devices currently that would help her kind of accommodate and just be able to participate more in the general ed curriculum. And then she has an interpreter all afternoon at Blue Valley who interprets for whether she's working with LaDonna one-on-one on math, if she's in the resource room, if she's in the classroom, even goes out to recess with her and kind of helps during those social settings. And the interpreter is really, and I'll talk about this a little bit later, that's a skill that she really has to work on and learn. And so it's something that even though she's there learning math, she's also during that process really learning how to use an interpreter successfully. And then another piece of the team is OT, PT, and speech. So when we have IEP meetings, it's a big group that comes, but this team has really worked well together and just has collaborated well together, and Josie's been really fortunate to have so many people really in her corner working on her team. Just some things that come up I thought I might share with you just related to medical and hard of hearing, because it kind of can hit those other health impairments and that hard of hearing deafness category that you've been looking at. Medical concerns for school. Well, Josie misses a lot of school because of surgeries and doctor's appointments. I will say as she gets older, we get a little bit more stable in her health, and so we don't miss quite as much. But that has been a challenge for her in the past, is the amount of school that she has missed. And teachers have done well at understanding that, sending homework home, but maybe reducing the amount of that work, just checking for understanding, not feeling like she has to do fully the same amount as her peers are doing in the classroom. We've connected with the classroom in the past with Skype to check in with friends when she's recovering from a surgery and she's been gone for a little while. And so that's been helpful too, just to help her continue to have that connection with her peers. The other thing that teachers are aware of with Josie is that she's easily fatigued, so things like field trips can be a challenge for her. If there's a lot of physical activity during the school day, just being aware of that, giving her some time to rest is important. Since Josie is not primarily an oral eater, there's feeding tube support that's required by the school, and so the school goes through training on how to do her tube feedings, what safe oral foods she can have, so she can eat things that are like pudding consistency. She can drink a little bit, so she can have things like juice or water. Those are safe things for her, and those are all included in her IEP on her medical information. And then teaching other students about medical issues. We've found it's been really helpful to really just let kids ask questions and teach them about some of the things that occur in Josie's day that may not look typical to them. So when she was in preschool, during Feeding Tube Awareness Week, we took in a couple of dolls that she has that we have converted to tube babies. So we've put in a feeding tube in their tummy, and we let the kids practice feeding them and talked about how it doesn't hurt Josie to eat this way, and Josie doesn't swallow kind of like you swallow, and this is why she needs a feeding tube, and talked about the foods that we put in her feeding tube. Because Josie's on a blended diet, so we blend up food for her and put that food through her tube. And so we did a little fruit and yogurt blend for the kids that they got to drink kind of like a smoothie, and then showed them how we would put that in Josie's feeding tube. So it really kind of calms maybe any nervousness they have, because it is unusual for them to see a child being tube fed. It lets them ask questions, and a lot of them have been with her for so long now that, you know, it's nothing for them to see LaDonna doing a tube feeding. They understand why she needs it. So we've really found that it's more beneficial to be open with Josie's peers about what her needs are, and really helpful. Just some hard of hearing, deaf concerns. Josie is a dual language learner because she's learning how to sign in ASL. Her home, even though we sign and we are learning how to sign, we are not natural signers. Our first language is English, and so that does make language development a challenge for Josie. We know it does. The other thing that Josie's learning how to do this year is learning how to use an interpreter. We have used interpreters for the last 3 years at doctor's appointments, which are provided at no cost when Josie has a doctor's appointment. But that's really a skill that you have to learn how to use. She's done well doing that. It gives her a voice at doctor's appointments. I find that the doctors pay more attention to her thoughts and her concerns when the interpreter is saying it than maybe when I am communicating it for Josie. But learning how to use an interpreter in an education setting is a very different skill, and it's a challenge. So she really has to pay attention to what the interpreter is signing and not letting what maybe the student beside her in her desk distract her. She has to have that visual focus and really pay attention, and also be able to express if she didn't get the whole concept or if she needs something repeated. Really learning how to advocate for herself in that is an important skill. And that's something that LaDonna, her para, who is also deaf, helps her with when she goes to Blue Valley in the afternoon. LaDonna is really helping her learn how to use that interpreter. The other challenge for Josie in a hearing environment is supporting those social interactions. So again, she still needs that bridge of an interpreter to be able to talk to her hearing peers. And so that's just an important skill for the classroom teacher who has really fostered that. Also allowed Josie to be a sign teacher in the classroom. So every week she teaches the class some new signs, which helps them learn sign language. But just really developing that social interaction and helping her, even in those times like recess, helping her really foster that social interaction. And then the other area that takes some getting used to and some learning is how the teacher gets used to an interpreter. So where to place the interpreter as the teacher's standing up at the board teaching, kind of the rate of your speech, talking maybe too fast can be a challenge for the interpreter, pausing, allowing the interpreter to check for understanding with Josie. All of those things really play an important role in how effective the interpreter is working with Josie in the classroom. And then I will say for us, we've been so fortunate with our team that we've had a great relationship with them all along. And the only way that happens is if we communicate on a regular basis about what's going on with Josie. And, that comes from both sides. So I communicate a lot about Josie's health or what's going on because I know that can impact her school day. So if I know right now she's struggling to sleep because she's having some pain, I let the teachers know that so they know, hey, the reason that she doesn't seem focused today is because last night she didn't have a good night of sleep. So just helping teachers understand that piece, and then them also helping me understand kind of what she's learning during the school day and help me support that at home. So sometimes they'll give me resources I can use on how they're working on different academic skills, and that communication is just such an important piece. Even when we started looking at dual placement, we really started communicating with the team early on in January, February about, hey, this is something we're thinking about. What do you guys think about this? What would it look like? This is why we're considering it. Just making sure that we were really communicating well with the team. And I think, that also helps the team just understand to have high expectations for Josie as well. I think that's the key thing for us. When Josie was 1, we saw a developmental pediatrician at Children's Mercy, and they did some testing on cognitive development, things like that, and gave us a diagnosis of moderate mental retardation, which really at 1 would be a hard thing, I think, to put a diagnosis on. But we didn't settle for that, and we had high expectations for Josie. Today, Josie is almost reading on grade level. She is making progress in math. She's writing well. She's successful. She likes school. We had high expectations for her, and we will continue to have those high expectations. And it also helps then when the team has those high expectations. For us, college isn't off the table yet for Josie. We're not ready to say, this is what we think you're going to be able to do when you turn 18, or, we're not sure. The expectation is we're going to prepare her for college so she at least has that choice to make when she graduates from high school. The other thing I would just say in terms of relationship with parents is there is a lot of nervousness about the IEP process. I was a special education teacher. I've conducted lots of IEP meetings, but I'll tell you, it's a different feeling to sit on the other side of that table as a parent. I remember the first IEP meeting that we had for Josie was during her time getting ready to transition into preschool. And there were about 10 people at the table, and then Chad and I walked in, and it was an overwhelming experience, to have that many professionals involved, to have everybody giving their input, to be looking at that IEP document and trying to process it. It was a challenge. And I will say for parents, I know we've had this feeling. We kind of have tunnel vision on what Josie can do, on a regular day. We see her as normal to us. We see her as having normal development because, we're just with her all the time. We don't always see the areas that maybe she's falling behind or the areas that she's different from her peers. And so during that IEP time, it's always a time that parents are kind of reminded about the differences in their child. And so it is a time where there can be some sadness, where you go through again that process of, hey, my child is not going to develop like a typical 8-year-old. And so as you're sitting there getting all this information in the IEP, those thoughts are going through your head too. So it's a challenge for parents, I think, that I didn't really understand when I was a special ed teacher. And so a couple things that really help us with the IEP process is it always helps to ask for our input. I know parents aren't always very good at giving input, but giving them a couple options for doing that, checking in with them, asking for that input is always helpful. And I find that it's helpful for the team to see where Chad and I are kind of thinking, and maybe even see some of the things we're struggling with at home that could be addressed in the IEP or addressed in some of those related services. It's also helpful when we can get the IEP ahead of the meeting, so we have a chance to read it together, to really think about what it's saying, think about what the goals are, and do they reflect the goals that we really want to have for Josie in the next 12 months as well. And think about any questions we may have that we can ask the team ahead of time to get those questions kind of cleared up. So it's always better if you can give that IEP to the parents ahead of time. It's very overwhelming to go into that meeting and be receiving new information as well as people talking to you about what your child is doing. So I hope that just offers some clarification on maybe just an example of what parents experience, what parents go through. I will say that for us, we've had a great experience with the teachers that Josie has worked with. And although it's been a challenging 8 years getting Josie where she's at, she wouldn't be where she was if it wasn't for the special education teachers and the related service personnel and the nurses who really took effort and really had high expectations for her learning and saw the potential that she had, even beyond all of these challenges that she deals with on a daily basis. So I hope this gave you a different perspective kind of on what parents experience and help you as you develop those partnerships with your families in your classroom.